really is. Most people don't think of their dentist as being, able to diagnose things in the rest of the body, but gum disease is an indicator for many different diseases: heart disease, diabetes, risk of stroke, and heart attack. It can also be related to pancreatic cancer for men, and for pregnant women, it can be related to premature births.
Now, why is that? Is it because of the secretions that's created? Is it because of the bacteria that's created that leads to all these other diseases, or it links it?
It is. They've actually found the same bacteria in dental plaque in arteriosclerosis, clogged arteries that can cause heart attacks.
Oh my
So that bacteria can get into the bloodstream through bleeding gums and get to the rest of the body. Also, the bacteria that cause gum disease can release toxins into the body, and that can cause problems with inflammation throughout the system.
Now, we've got some pictures that you brought along with you that really kind of dive into and show, I guess, this is the different stages, is that right, of gum disease?
That's right. And the good thing about gum disease is it's so easily preventable. When it's just in the first stage, which is gingivitis, it's completely reversible.
And is that the top one?
That's the top one. And as you go down, it simply progresses into more severe stages. And the very last stage, I mean, you can see, first of all, it's not very attractive. You wouldn't want to walk around with your teeth looking like that. But it's also very dangerous. It's the leading cause of tooth loss.
So you've got 4 stages here. The first one, if somebody comes to you and says, Dr. Paige Lester, can you fix this? You can do something about that.
We can do something about
What about stage 2, 3, and 4?
We can treat, the earlier you can get it treated, the better. We can stop it and control it and prevent it from progressing into the more serious stages. It does require visiting your dentist and your dental hygienist and getting those stages treated. There's no cure for gum disease, but it's so easy to treat, and it's painless and it's easy, and there's just no reason not to get it treated.
Now, how would you know if you're at home and you feel like you take good care of your teeth, you floss, you brush, you use Listerine or whatever kind of mouthwash you choose? How do you know if you've got symptoms or could have gum disease?
Some of the most common symptoms are red, bleeding gums, swollen gums. You also can have teeth that shift position. You'd start to notice gaps in between your teeth. That can mean that you've got some serious gum disease happening. It can also cause chronic bad breath, which most people would not like to have.
Oh my gosh. Then you think somebody would tell you, but not always, right?
Not always. Some people try to be tactful. They won't let you know that you've got bad breath.
Now, Dr. Paige Lester, tell us how people, if they've got questions or want to see some more information on gum disease, how can they get a hold of you and your practice?
I would be happy to answer any questions. They can reach me at 991-9535. We also are on Facebook now. We've joined the bandwagon.
So are you on Facebook?
They can look for Drs. Clark and Lester on Facebook. We post some case photos and some information and some links that they can go to find out more information.
Okay, the practice of Clark and Lester Family and Cosmetic Dentistry. We appreciate you, Dr. Lester.
Thank you.
Thank you so much for being here. We're going to take a quick break, and we'll be right back. Stay with us.